Hello everyone, allow me to introduce myself. My name is Agnes Uliarta Simurat with student ID number 23742. In this opportunity, I will present and explain my response to the case of refusing treatment due to religious belief. In response to this case, should doctor respect age and their families' wishes not to receive a blood transfusion? In my opinion, I agree that doctors should respect age and their families' wishes not to receive a blood transfusions. From a perspective of human rights and patients' autonomy, A is nearly of an age where they are considered an adult and possess full mental capacity to make medical decisions. Therefore, their decision to refuse a blood transfusion should be honored, although the outcome may pose a fatal risk. The principle of respecting patients' autonomy is a strong ethical foundation in medical practice. In this case, human rights and patients' autonomy take a central position. Patients' autonomy is the most fundamental ethical principle underlining an individual's right to make medical decisions regarding their own health, including the right to accept or decline treatment. This principle is grounded in the human right to have freedom and control over one's body and health. Hence, when a patient like A is deemed an adult and has full mental capacity, their decision to refuse a blood transfusion should be respected. Doctors also have an ethical duty to carefully and objectively assess the patient's mental capacity. If the patient lacks mental capacity, the doctor may need to seek decisions from a legal guardian or the patient's family. At a tribunal, the principle of "near tolling" must be applied, meaning doctors should not impose their personal belief or values on the patients and should respect the patient's belief. And in the case prohibiting blood transfusions, decide the patient's decisions carrying a fatal risk. Medical ethic principles still apply because patient's autonomy is priorities and the patient has the right to take risks with their own decision as long as they process adequate mental capacity. This reflects the commitment to maintain a balance between respecting patients' autonomy and considering the patient's well-being in ethical medical practice. In conclusion, in this case, doctors should respect the wishes of patients A and their family not to receive a blood transfusions based on the principles of human rights and patients' autonomy. Patients' autonomy is a primary ethical principle that must be upheld in medical practice. Even in the face of fatal risks, it requires an assessment of patient's mental capacity, doctor neurality, and the explorations of suitable alternatives in accordance with religious belief. The conclusion emphasizes the importance of maintaining a balance between respecting patients' autonomy and considering the patient's well-being in ethical medical practice. So that's the end of my explanations regarding my perspective on the case about the case of refusing treatment due to religious belief. And I apologize for any shortcoming. Thank you for your attention and see you again.